Dr. Rick Jacoby here in beautiful downtown Paradise Valley at the Camelback Inn with Dr. Jain.
I'm Dr. Krishna Jain. I'm a vascular surgeon and I'm associated with medical school in Kalamazoo. I'm also the chief medical officer for Apex Health Network.
And it's a pleasure to meet you. I met you through Dr. Ramaiah, who is the chairman of this Congress. And our mission here today is to amalgamate podiatry with vascular surgeons. We've been separated for the last couple of years because we were in our own silos. You in an OBL, an office-based laboratory, and I over in an ASC, a surgical center, and we're going to get together again. And this is going to be excellent for the patient, better care, lower cost, and more expertise coming to bear on the problem.
Yeah, I agree with you. So let me give you a little history. I'm a vascular surgeon, and we started helping people opening OBL so that people can provide all these endovascular intervention in the offices as compared to the hospital system, which is much more cumbersome. So I've been doing it for about 15 years. But one expertise I don't have is podiatry, surgical podiatry. And ultimately, this care is so fragmented, we can revascularize the leg, but if they don't get good care for their wound care, they still lose their limb. So what did we achieve? So a few years ago, my goal was to marry OBLs with wound care centers. So I approached a company, they were not interested, but a couple of people who used to own their wound care company, they left their bigger company and we made a company together so that we can provide comprehensive care in terms of perfusion and the toe and flow model. Toe and flow, you got to take care of the feet, so we need surgical podiatrists and we provide the perfusion. Yeah.
Perfect marriage, perfect marriage. So my expertise is from Dr. Dellon. We were talking about that earlier because he is the world's leading authority on nerves, peripheral nerves. He had perfected this procedure on the carpal tunnel and the ulnar tunnel, applied that to the lower extremity. Nerves get compressed by the action of sugar chemically, and they cause a physical reaction. That has to be opened up, those tunnels. Inside, there's an artery, obviously. Now, if that artery is clogged up inside, that needs to be cleaned out. But it also has to have that pressure released on the outside. Then we can address the ulcers that are end stage of that process. Numbness, tingling, burning, loss of function. When we do that procedure, sensation comes back. So we need that marriage between our two specialties. Now, if we did this surgery and there's no blood, we've accomplished nothing.
Yeah.
So this is a great opportunity.
No, so thank you for all the work the surgical podiatrists do to keep limbs alive. But overall, I look at limb preservation as 4 pillars of limb preservation, and those 4 pillars being medical management, perfusion, ulcer care, and management of peripheral neuropathy. And the procedure you're describing obviously helps with peripheral neuropathy because diabetic patients don't have sensation. They step on stones. They never know that they have an ulcer, and before they realize they're badly infected. And when they come to us, we are at the cusp of losing their leg. So working together, unfortunately, in the healthcare system, in the hospital-based system, care is very fragmented. So in the outpatient together, we can work and hopefully save a lot of limbs.
Oh, I think we will. There's a paper that is out there by Shai Rosen at the University of Texas. Sham surgery on one side, double-blind study, looked at the standard of care and doing the Dellon decompression, 76% better outcomes just with that one procedure. That's game changer.
It is, but how do we get all the podiatrists to do that procedure? I'm not sure all of them do that.
Well, there's the Association of the Extremity Nerve Surgeons who's teaching and training those doctors as we speak.
Oh, that's wonderful. I mentioned to you earlier, I did meet this younger podiatric surgeon in Washington State, and he was explaining the whole procedure. He does a lot of those. So I believe he's one of the trained podiatrists who does that. But again, when we're working with podiatrists, in my experience, when you work with a surgical podiatrist, you get a different experience for the patient, and there's much more chance of saving a limb after perfusion versus a regular podiatrist who does not have that specialized training.
You do have to have this specialized training. So we only take board certified podiatrists who have done all that other stuff, the orthopedic side of it, and then we train them at the Association of Extremity Nerve Surgeons. We have training courses, we have the philosophy behind Dr. Dellen's work, and I also worked at Stanford with Dr. Cook, figuring out the biochemistry behind the nerve compression. So we have it all out there. My first book, Sugar Crush, which has been out now for 10 years, I explained all that. Not a lot of people have taken it to heart, so to speak, as I say. And now my new book, Unglued, is going to expose the underlying cause of all this stuff. So we can work with a vascular surgeon, with podiatry, with wound care people, we can solve this problem.
Absolutely. One of the things that is lacking, though, is including Phoenix, and I have to ask Dr. Ramaiah about that, the lack of outpatient wound care centers, because many of the wound care centers in the hospital, and patients have a hard time getting to the hospital. Number one. Number two, they doesn't have the capacity. And the hyperbaric oxygen works very well for Wagner 3 and worse wounds. And unfortunately, we just don't have access for the patients to get to good wound care centers. So our hope is that together we can build a lot more wound care centers where patients can have easy access, as well as be taken care of by trained people who know what they're doing. And we need to do a much better job of educating our patients in terms of taking care of the feet and just overall understanding how they can lose a limb. Because as you and I talked earlier, after amputation of a limb, 50% of the patients are dead within the next 5 years, which is much worse than cancer.
Worse than cancer, because we've never changed their diet.
Yeah.
That's an absolute must. Sugar is the cause. It's a glue, as we talked about. And if we do all these things, stem cells fit into this scenario quite well. But it really comes down to diet. We can do so much to clean the artery out and restore the nerve, but we got to change the paradigm.
Patient education.
You
start with patient education. Thank you, and good to see you.
Good to see you.
Thank you very much.
Thank you.